How are you guys doing this evening? Good, all right. That's actually better than I thought. I was going to tell you that if this is probably a success if I don't make you repeat that louder. We'll all be happy, so I'm not going to. We're just going to continue on here. So, again, I'm Dr. Chris Seitz. I'm an emergency physician by trade, but as Archie said, I serve as the CEO and Chief Medical Officer for Guardian Medical Direction. Today, I'm talking about the very exciting topic of navigating compliance for your healthcare business. So I've got 30 minutes to tell you about everything I've learned on how to do that in the last 2 years. So we will do our best, and if you can extend some grace, that would be awesome. I'm going to start here with a quote. Everybody likes to start with a quote. So when you reduce life to black and white, you never see rainbows. And I love this quote. This is actually a quote I stumbled upon when I was preparing for this. In healthcare, for some reason, again, I'm a clinician and I'm a business owner. Who else here is a clinician and a business owner? A lot of you, right? We have this tendency as clinicians to, I feel like I always tease that there was a day in medical school or nursing school or PA school where, and none of us remember the lecture, but a lecture was given where they said, if you don't understand it, it's a threat to your license. For some reason, I feel like that's a lecture we all had, but we can't remember when it was. And we have this habit of saying, hey, you know what, can I do this or can I not, right? Is this the right medication or is it not? And a lot of times we forget about the art of medicine. And what I love about what we're doing here today and what Chris has done with this conference is that I think we're being allowed to explore the art of medicine again. And that's a really important aspect of medicine, right? We wouldn't be where we are today without that component. But it becomes really difficult when you're trying to start a business in healthcare to try to navigate between black and white. And this quote I love because a lot of times we talk about like, well, it's a gray area, right? It's a gray area, especially when you're doing something innovative in healthcare, you know, like, well, what do the regulations say? How do I structure this? Can I do this or not? Like, well, you know, it's not really black and white, it's gray. And I kind of hate that because nobody wants to operate in the gray. It makes you feel like you're probably doing it wrong. But I think what we're doing here in the businesses that we're starting here, I don't think it's gray. I think it's finding the rainbows in it, right? Maybe it's not quite black and white yet, but it's our opportunity as clinicians and business owners to find that rainbow in between that spectrum, right? I'll tell you what does feel gray to me is as an emergency physician when I have to call an insurance agency to give my patient a CT scan, right? So we think a lot of times that traditional medicine is black and white, but I'll tell you what, that feels more gray than I think what a lot of us are trying to do here today. And so as we attack this topic of navigating compliance for your healthcare business, I want you to start with this mindset, right? Let's look for the rainbows in between the black and white. So for those of you who have started healthcare businesses or practices before, raise your hand if you have one. It's already open and ready to go. Awesome. And how many of you are thinking about starting one, trying to start one, you're trying to learn here today? A lot of you as well, right? So for those of you who have already done it and those of you who are about to do it, the first question we always ask is this: can I do this, right? Hey, I'm a nurse, hey, I'm a paramedic, I'm a chiropractor, even I'm a doctor. Can I do this? And the resounding answer should always be yes. So if you're talking to an attorney, and I think Jeff Cohen did a great job of talking about this earlier, if the answer should be yes. If you're talking to an attorney, the answer should be yes. If you're talking to a physician colleague, it should be yes. If you're talking to your friends who have done it ahead of you, it should be yes, right? And most of you probably have gotten that resounding yes in some aspect, right? You've surrounded yourself with people who will say, yes, you can do this, and that's so important. But then there's the follow-up question. Are you sure? And that's where all of a sudden people are like, well, yeah, but like it's complicated, or, like absolutely, but you should talk to an attorney, or, well, in Texas it's a little, and all of a sudden one of two things happens. Either you start looking for the rainbow, or you don't do it. So I'm going to start this whole thing. We're going to talk about navigating compliance. We're going to talk a little bit about corporate practice of medicine. We're going to talk about MSOs and practices, and we'll see if we all understand it at the end, okay? But I want you to start here again with this looking for the rainbows. The answer is yes, you can do this. How you do it might be different than your colleague in Michigan or California. What you do and the way you do it may be different because of how you want to do it. But the answer is yes. It's figuring out how we do it. And again, this is our opportunity as clinicians and business owners to push this industry forward and say, yes, no, I can do this, and I'm going to surround myself with the people to help me do it the right way. So our goals for this, we're going to talk about the difference between a healthcare business and a healthcare practice. I'm going to try to explain corporate practice of medicine in a way that makes sense in the 30 minutes I have, and how to set up an MSO and practice relationship. We're going to review scope of practice a little bit as it pertains to the business services that you provide, and we're going to share some practical ways. I want to make sure I give you some practical things to walk away with here to make sure that if you're establishing a business, or if you already have one established, that you bring that business into compliance if it's not there already, okay? So let's start with the one question you have to ask. Caveat with one other thing too. I may cover things here today, if you already have a business, that you go, oh shoot, I didn't do it that way. That's okay, all right? The last thing I want you to do is rush out of here freaking out about something, right? I think, again, going back to that sentiment of finding rainbows, just because it's not exactly where you maybe would want it to be today, or maybe you get some ideas today of how maybe to restructure, that's fine. Just go do that, okay? I think a lot of times, especially in this industry, especially in healthcare, we get real scared real fast, again, when we don't understand certain things. And that's what we're here to do. We're here to learn it and do it better and different as we move forward, right? So one of the questions you have to ask yourself when you're starting a business is, am I starting a healthcare business or am I starting a healthcare practice? And I'm going to define both of those here in terms of how I'm going to use them today. But a healthcare business is essentially really like any business entity that helps facilitate the provision of healthcare to patients. An IV hydration clinic, would you argue that it facilitates that delivery of care? Yeah? Right, it does that, right? So does your primary doctor's office too, though, right? That their office is facilitating that care. So that's a healthcare business. But what's a healthcare practice? A healthcare practice is typically comprised of, one or more physicians. Obviously with, NPs that are autonomous can do this as well, but typically it's physicians, NPs, organized to provide actual patient care. So there's healthcare business, which is the facilitation of that care, and then there's healthcare practices that are actually liable and responsible for that true actual patient experience and the provision of healthcare. Does that make sense? So one thing we need to do before we move on, though, is a lot of you raised your hand saying that, yes, I'm a clinician and I'm a business owner. You need to take your clinician hat off right now, okay? We are going to strictly talk. I will tell you when you can put it back on, but right now I want you to take it off. Just from a business standpoint, we're going to talk about healthcare business and healthcare practices. I don't want you to be, in your mind, a provider in any point until I tell you, okay? So from a healthcare business standpoint, they facilitate care, healthcare practices provides that care. So you say, okay, Chris, that makes a lot of sense. Sure, I get it. So who can have a healthcare practice then? Well, it's not black and white, right? We got to talk about corporate practice of medicine. Who's heard of corporate practice of medicine? Hopefully many of you. Who hasn't? If you haven't, raise your hand too, right? We have a chance to be honest. Okay, maybe a couple of you haven't. Okay. Corporate practice of medicine. A lot of people, when they come to us at Guardian and they want to start a healthcare business or practice, they say, hey, Texas has they have a strict corporate practice of medicine law. Corporate practice of medicine is actually a legal doctrine, okay? So every state has some type of corporate practice of medicine stance, right? Sometimes you'll hear like, oh, these 7 states are corporate practice of medicine states, or these ones are not. Every state has some type of corporate practice of medicine doctrine. The idea of corporate practice of medicine is that if Gary Brecka hires me at his 10X clinic and says, Dr. Seitz, I want you to come in and I want you to provide care to these patients, and I say, awesome, let's do it. And I come in there and I'm delivering care and I'm like, you know what? I just saw Mr. Smith. He doesn't qualify for this genetic thing that we want to do. And Gary goes, well, too bad though, it makes us a lot of money, so prescribe it anyway. That's corporate practice of medicine, right? There's no state that says, yeah, that's fine, go right ahead. Amazon can tell doctors what to do. Like no one's doing that, right? Some states have stricter laws and regulations around that doctrine that better define it. But all states have some, no one's out there saying like it's perfectly fine for any CEO to tell nurses, doctors, paramedics how to practice medicine. So that's the idea there, and that's important, right? It's a little bit of a separation of church and state, right? We want to be able to deliver health care in an effective, healthy way. And we want to be able to run successful businesses, but we got to be careful when they intertwine. And this is why I had you take your clinician hat off, because we get really confused as clinicians sometimes when it comes to this kind of stuff, because we sit in both seats, right? So again, I'll reiterate, right now, you're just a business owner, all right? So these laws and regulations aim to, again, protect patients, obviously, from deceptive behavior. We don't want profits to drive what's right for the patient, all right? So you're like, okay, Chris, I get that. That makes sense. Corporate practice of medicine, got it. I get it. I love it. It makes a lot of sense for my clinics. So who can own a healthcare practice? We're going to keep looking for those rainbows because it's still not black and white. Here is a list of corporate practice of medicine states as defined by one attorney group. And I put it by one attorney group because, and I actually just had the opportunity of talking with Jeff Cohen outside, and I can say this because I said it to him and he laughed. But if you ask 4 attorneys, you'll get 8 answers, right? So the reality is that you need to consult an attorney, right? You got to consult an attorney about your state and say, hey, based on the regulations and laws around corporate practice of medicine, can I own the healthcare practice or should I just own the healthcare business? And I go back to the first thing I said, that the answer is always yes, that you can do this. How you do it might be different in your state, right? How you do it might be different. And we're going to talk a little about how you do it moving forward here, okay? You with me so far? Corporate practice of medicine makes sense? Okay, got it. All right, we're going to keep going. So how do we compliantly then structure or integrate a healthcare practice into your healthcare business, right? How do we do both of those things compliantly and legally? And that's where we start to talk about this MSO practice model. Raise your hand if you've heard of the MSO practice model. A lot of you had, good, okay. So an MSO is a managed service organization, right? That is the healthcare business. An MSO is a healthcare business as we defined it in the beginning here, okay? They facilitate the delivery of care. A practice, and we talk about PLLCs or PCs, a professional corporation that's a healthcare one run by physicians typically, that's the practice. So what we do in these models is that we take the managed service organization and we bind it to the practice with an MSA or a managed service agreement. And that agreement basically says, hey, I as the doctor who own the practice, right, I'm going to contract you as the business to facilitate that delivery of care, okay? And that's how we bring those things together. In this model, the practice really needs to be collecting patient dollars for healthcare services. Now, how they pass that back or how they pay that back to the MSO, that can be a rainbow for you to figure out with you and the doctors you work with and the practices that you work with, right? But again, this is the model where you have a healthcare business facilitating that care and you have a practice owned by physicians, and we bind those two together with a managed service agreement. And then, again, the money flows in the right order. Everybody lives happily ever after, including the regulators, and we're done, right? It sounds simpler than it is, but it actually is pretty simple in this kind of the way we're categorizing it right now. The managed service fee, though, is where a lot of people get hung up, okay? How many of you know what I'm talking about? If you own a business in a strict corporate practice of medicine state and you've had to do this MSO model, how many of you had a hard time figuring out the managed service agreement, like the managed service fee piece? Anybody? Okay, I see hands, right? Because this is the point where we have to switch our thinking. Again, we're still keeping our business hats on today, right now, because this is important. The managed service fee actually is the fee that should be going to the healthcare business, right? My practice is actually paying the healthcare business to deliver care. But you're all here today trying to start the healthcare business, so you got to go find a practice, and you almost negotiate it backwards, right? So you just have to recognize that you're doing that. It's doable, and people do it all the time. And there's lots of models where, as the healthcare business who's facilitating the care, and you're doing all the work, and you're doing all the marketing, and you're hiring everybody, and you're buying all the supplies, you should probably have all the money at the end of the day. And there are models to put that together. But you kind of have to switch your thinking a little bit that the managed service fee is actually coming from the practice and going to the business. But again, keep in mind that you can structure that in a way through that managed service agreement. This is the biggest snag that we typically see when we've helped like over 1,000 clinics start in this manner. And this is the biggest snag we see, is just wrapping your mind kind of around how that fee works, right? It seems a little scary because you're like, well, wait a second, like, no, like, I just started this business and I need you to come in, but like, why are you paying me? It's, again, we have our business hats on. It's how we're going to legally do it to make sure we're compliant, okay? So this is, the managed service fee becomes an opportunity for you to see a rainbow, if you will, right? These can be structured lots of different ways. In some states, you can do percentages. In other states, you do the fixed fee. Talk to your attorney, work with a Jeff Cohen and stuff like that to make sure you have that structured the right way. But this is how the relationship needs to be set up to be compliant, really in, obviously, strict corporate practice of medicine states, but in a lot of other states too that maybe don't have as strict of a model, and we'll talk a little bit about that next. So things to consider when you're setting this up. Who's responsible for what? Like, again, going back to if you're the facilitator, if you own the business that facilitates the care, and you're doing 99% of the work, then build a model with the practice and the doctor that you get 99%. I mean, it should be that type of thing, right? However, we need to word that in the contracts, like I said, the attorneys can make that happen. What works now, but will also work in the future. And this is an important piece too. And I might be speaking out of turn here and make some enemies in a second, and I hope I don't, but there's a lot of models out there today where it's rev share, right? Yeah, we'll do this with you. We got everything for you, and we'll take 9%, we'll take 15%, we'll take 30%. That's a great model, and that's fine. I mean, that like there's franchise models like that, and like just to make sure that it's actually bringing that value. Because we get people that come to us and say, listen, like I connected with Dr. Smith, and I told him I'd give him 10%, but the guy just sits on the other side of the phone, and I only ask him questions every once in a while because I don't need a lot of help. And now I've built my business to, $1 million, $2 million, $10 million a year, and he's taking 10%, right? I mean, like, make sure that when you structure these in the beginning, that you're looking at what's going to work for me now, what can I afford now? Obviously, we got to make sure we're controlling cash and things like that if we're starting businesses, but what's going to work for me in the future too, right? When I am successful, not if, but when I am successful in this, is this model still going to work for me? Okay, it's just something I'm going to get you guys thinking about these things today. And everyone's answer might be a little bit different. Again, right, your rainbow's gonna maybe be a little different color than mine. That's okay, right? So I want you to look for these opportunities, but think about these things as you begin structuring. Again, what structure is allowed in my state is a very important part. Talk to the attorneys about that. And then also, what's your ultimate goal? And I'm gonna come back to this, what's your ultimate goal, but you hear in business a lot that you need to kind of like start with the end in mind. What is your plan? Is this a 5-year plan, a 10-year plan? Is your plan to scale this business and when you die, it dies? Is it to hand it to your kids? Think about those things as you're structuring this in the beginning here, because it is going to dictate kind of the model that you put into place. And we'll talk about a little bit more kind of a recommended model. There's two models that you can follow. One is where now again, so what we're going to do here is we still have our business hats on. So keep that in mind, right? In the business hat that you wear, you can't own a healthcare practice necessarily in some states, but maybe in some states you can, or you can own part of it. So there are two models that we can follow. We can say, hey, you know what? I'm going to own the healthcare business, the MSO, and I'm going to own 49% of the practice, and the doctor will own 51% of the practice. But what a lot of people do is say, well, hey, if I own 49% of the practice and you own 51% of the practice, then we don't really need an MSO as well, like that will just be everything, okay? You see, my tip here is start with the end in mind. Selling a healthcare practice is very different than selling a business that facilitates the delivery of care, okay? So more and more what we're seeing is that states are starting to say, hey, listen, you have to let us know if you're gonna sell a healthcare practice. I'm licensed in all 50 states now. I got a notice from the board of Connecticut recently and just said, hey, doctors, this is just kind of went out to everybody, but hey, we are aware that private equity is buying up healthcare practices. The research shows that when that happens, maybe the care declines a little bit to patients. So moving forward, if you're going to sell your healthcare practice in Connecticut, you have to file something with the state, and we'll decide if that's okay or not. So again, as you think with the end in mind, right? If you want to scale this business and sell it in 5 years, 10 years, 15 years, maybe you don't want to own the practice. Maybe you want to own the business and partner with a practice that understands that model and can help you do that, because you can sell that facilitating entity all you want, right? We're starting to work with more franchises at Guardian that say, hey, listen, like, sure, in corporate practice of medicine states, we need a doctor to own the practice. But even in non-corporate practice of medicine states, we'd like them to, because then we can just build our businesses and our franchises and we can sell them, and we don't have to worry about selling healthcare, right? The practice is taking on that liability. The practice is taking on that ownership of the healthcare, part of it, and we're the business that facilitates that. So again, something to think about. The other model, obviously, is what I just talked about, where the practice is owned 100% by the physician, and the business owner, you the business owner, we have our business hats on, right? You the business owner own 100% of the business, okay? Everybody still with me? Yeah. All right. So now we're like, okay, I get that. I understand the difference in healthcare business and practice. I'm thinking about these things, and hopefully you guys go home and ask yourself more questions about how do I want to structure this? How do I want to do this? I understand the models now. I understand the need for the models. I've structured my healthcare business correctly for me, right? Now what services can my business or practice offer, right? Now it's time to put our clinician hats back on, okay? So that was all business. That was how we structure a business when we're trying to do healthcare business stuff. Now we can put our clinician hats back on because now we've got to talk about scope of practice. I see this happen a lot where people say they mix, because a lot of us are clinician owners, they mix all of the kind of like legal components into one, right? So you're starting your business and you're like, well, what does the Board of Medicine say? Well, up until right now in my presentation, the Board of Medicine doesn't really have a say, okay? It's the state and the Attorney General's office who's saying how healthcare businesses need to be structured. But now, in terms of what kind of things we're gonna do within those businesses and practices, now we fall under different regulations. Now we can take our license out, and I can take out my MD license, and you can take out your license and say, hey, this license falls under the regulations of the board, right? The Board of Medicine, the Board of Nursing, the Board of Pharmacy, whatever it might be. This is another aspect we now have to think about within our businesses and practices, okay? So scope of practice basically, and you guys know this, but scope of practice basically means what am I allowed through the regulatory entity that I'm under, the Board of Medicine or Nursing, to do with that license? And what's kind of wild is that it actually depends on what state you're in, right? People don't necessarily realize this, but even as an emergency physician, there are certain emergency procedures I can do in Michigan that I can't actually do in Ohio without like another like cert or something like that, right? And a lot of times people think, especially at the physician level, like, well, hey, like once you're a physician, you can do whatever. If you're board certified in emergency medicine, it means that you can go do that same type of emergency medicine everywhere. It's actually really not the case. There are some clinics that hospitals that I've worked at where I couldn't administer ketamine on my own. There are others where I could, right, for sedation and things like that. And it's same for you guys too, right? So any degree you have within the license of medicine falls under a board. So now we got to start thinking about, once we've structured our businesses correctly, how do we provide the right oversight to the licenses that we have, right? Just because I serve as a medical director for a clinic doesn't mean that they can now just like intubate in their clinic whenever they want because I can. It doesn't work that way, right? There are certain things that they can and can't do. So now we have to consider what's permitted under our license in our state. And that's where we go to the Board of Nursing or the Board of Medicine or the Board of Pharmacy or, everybody's got the Board of EMS, everybody's got a board, right? And we say, hey, what's within our scope of practice? Sometimes there's opportunities for rainbow there too, right? So sometimes you say, hey, can I do this? And they say, well, here's the regulation. And it's like, okay, well, that didn't answer my question. There's actually a Bermuda Triangle that people don't really realize, is that if you call the Board of Medicine, they will tell you usually to call the Board of Nursing. And then the Board of Nursing will say, you should probably talk to an attorney. And the attorney will say, you should talk to the Board of Medicine. And then you get stuck, and nobody starts their business because they get stuck in here, right? So again, we have to, and this goes back to, how many were here for Jeff Cohen's talk at 11? He did an amazing job. And again, there's so much synergy there with us because what he is saying is basically what I'm saying here too, right? You're not asking, can I do this? You're asking how I do it. And there are some cases where like, no, you can't. There is some black and white. But there's a lot of opportunity for us to say, no, how do we do this and how do we do this well? And that goes to, kind of having the right protocols and things in place. So you got to ask yourself when we get to this aspect of building our businesses, what's permitted either under my license or the license of the people I'm going to hire? Maybe I'm not a clinician at all. How many of you are not clinicians but healthcare business owners? Yeah, okay, so you're going to hire nurses, you're going to hire medics, you're going to hire NPs and PAs. You've got to understand what's within their scope at this level, right? Then you're going to have to ask what kind of oversight or supervision do they need, right, for their license? Do they need a medical director? On top of everything, do they need a supervising physician, a collaborative physician? There's lots of different terms there, and every state defines them sometimes a little bit different. So we got to ask those questions. And then you've got to ask, is the patient-physician relationship required for any of the services, right? we're seeing this happen more and more, right? Where they're saying, hey, you know what, there's got to be an establishment of that relationship. We can't maybe only work off of protocols, or we can't maybe work off of standing orders. We actually need to have a telemedicine visit first, things like that. And there's always a way forward. I want to be encouraging here that there's always a way forward. It's just, we just got to, and this is kind of what Jeff talked about too, we just have to make sure we're doing it in the way we're being asked to do it. And then again, what services or procedures are considered the practice of medicine? Some lasers may not actually be considered the practice of medicine in the state, but others may, okay? So again, we're talking about scope of practice. And so we've got our clinician's hat back on, and we're saying, hey, now we've understood the business aspect and the state requirements there, now we're gonna look at scope of practice, okay? So let's talk about practical steps as we summarize here. What are practical steps you can take? This is all great, but like, what do you do with it? We're gonna talk really quick. The legal structure, the scope of practice, patient relationship, the movement of funds, oversight, and first do no harm, okay? Make sure the business or practice, is structured correctly, okay? And that's what we talked about, that MSO PLLC model, that practice model, make sure it's done. If it's not that way for you today and you're like, shoot, no, I wanna do it that way, that's fine. Don't panic, don't run out of here and call your attorney. I mean, just like, you can do it. Just restructure it the way you want it to. When it comes to scope of practice, the way we protect scope of practice is we have very good protocols, procedures, and standing orders in place where we need them, okay? So you need to make sure you take the time to really, that's the practical step to making sure you're in compliance with scope of practice. When it comes to establishing the patient-physician relationship, you need to make sure you're either doing good faith exams, clearance exams. Now some states are saying, hey, we need treatment plans or prescriptions. That's doable, we can do that, okay? Let's just put that into place. That's the practical step there. If I need a patient-physician relationship, then we should do it that way. I will also encourage you as a physician, and just seeing where things are going, there are some states where you maybe don't need that today, but you probably will soon, or you probably will at some point. You don't have to use it today, maybe, if your attorney says it's not required, but make sure you have a plan, right? We see sometimes a lot of people who come and say, hey, my medical director, all of a sudden, like, they were a great medical director, but now he or she needs to see every patient, and they can't practically do that, so we need another solution for that kind of telemedicine side. From the financial side, make sure that the practice is collecting the money. It's all great to have it structured the right way, but what the regulators are gonna do, what the state's gonna do is they're gonna follow the money, right? So if the money's just going right into the business account and never touches the practice, are we really in compliance, right? So making sure the funds are moving the correct way. That's the practical way to make sure that from a financial standpoint, we're in compliance there. Establish the right oversight for you and your employees' licenses, right? Medical directors, supervising physicians, collaborative physicians, make sure that you have that additional medical oversight component in place. Just because you have a doctor who owns the practice doesn't necessarily mean that they have to be the medical director. You may need additional physician support with that physician to provide that, okay? And at the end here, ultimately do what's best for your patient, right? I mean, I really do believe, there's a lot of stuff to unpack here, but I really do believe, and I think you guys all know this to be true too, that if we're truly driving things forward in our businesses and our practices that are best for the patient, we can't lose, right? I mean, if the patient outcome and what's best for the patient is always at the forefront of what we're trying to accomplish, that's 99% of it there, okay? Awesome. Well, I'm going to refer back to Jeff because I just really enjoyed his lecture, and I think some of this is, he gave his number out at the end. So I'm going to give you Jason's number. It's 248. No, I'm just kidding. So awesome. Well, thank you guys so much. Again, I hope you guys gathered some information here that was helpful. Thank you. Don't panic, again, if you haven't done it this way, okay? These are just practical steps you can take. Come see us at our booth. We can answer more questions if you'd like. I was told I can't have a Q&A because we have more important people coming. I'm going to throw you under the bus. So, no. But anyway, please come see us at our booth. Thank you guys so much. I hope it was helpful.